My name is Summer Wilson, and I will be presenting on PBS, our Positive Behavior Support for the Advanced Topics in Applied Behavioral Analysis course. So the first question we must answer is, what is PBS? And positive behavior support may be best described as an individualized, meaning that this system or the support is focused specifically on a particular individual, their challenging behaviors, their skill deficits, the things that they need specific to them. And then it's also a problem-solving process grounded in ABA principles. So by it being a process, we don't just look at one particular behavior or one particular aspect or factor that contributes to behavior. We look at it as a whole, and it's always going to be grounded in those principles of ABA. So things like generality, being effective, technological, applied, conceptually systematic, analytic, and behavioral. And while we are using this problem-solving process, there are 5 things that Shigai et al. Tells us that we need to pay attention to and make sure that we're using to inform our intervention using positive behavior support. So the first is that we're going to use broad goals and behaviors of concern. So that means that we are going to not just look at one particular behavior, one particular skill. We're going to look at things that are definitely going to be pivotal for our learner or our client or our student. And we're going to look at behaviors of concern that are having really good operational definitions, things that we see across different settings. Another thing that we're going to pay attention to is gathering and analyzing of information about patterns that affect behavior. And so basically we are going to definitely make sure that our plan is individualized. So we're going to look at the different factors that contribute to the specific behaviors of concern, and then also looking at the skills that the individual may or may not have, and how those different factors, those sometimes like those skill deficits or the different factors around them are affecting that behavior, and use those patterns, which we'll talk about ABC data a little bit more later, use those patterns to inform our intervention. After we've done that, we're going to go and also focus on picking strategies that are based on the patterns and making a comprehensive plan. So we're not just selecting strategies because they look good, because they're fun. We're picking strategies that are evidence-based, that are going to increase the likelihood that our learner, our individual, or our client is going to develop skills, and also that it's going to reduce those challenging behaviors. And we're not just going to do one thing in isolation. We're going to look at it as a whole plan and take every factor into account and using those to help our learner or our client. Next, and this one speaks specifically to like the generality, is implementing the plan across settings and people. We cannot say that we have effectively taught our learner if they're only able to perform certain skills in certain settings or with certain people. We need to make sure that our plan is something that we can implement at least some of the aspects of, regardless of where a learner is. And then last is monitoring outcomes. Principles of ABA, we are a data-based, empirically based system. We use that data to inform our intervention, make changes as necessary, and we do that by taking and monitoring our data. The next question we will answer is, why do we use PBS? So the goal was to maintain adherence to the principles of ABA while devising approaches that could be acceptable and sustainable across settings. So that acceptable is a big part and that sustainable is a big part. We need to devise strategies and interventions that are going to be socially acceptable, things that people who interact with the individual we're supporting are going to be willing to do, and then also that they're going to be able to do. We need to select interventions, and positive behavior support has a lot that we can select, or lots of different factors we can select that will be helpful to make sure that our interventions are considered acceptable and sustainable. One factor we can definitely look at is that we use PBS or positive behavior support strategies to engage caregivers to take an active role in behavioral intervention. A major part of an intervention working is all the people being willing to participate in it and do it. It's one thing for a clinician, a technician, sometimes even, special education teachers to be able to do the different strategies that are suggested, but we want to make sure that we're using strategies and interventions that caregivers can use. And if it's things that they can use, they're more likely to take an active part in wanting to be a part of the intervention. The last thing we want to do is set up an intervention strategy that's only going to be used during session. We want something that our parents, grandparents, aunts, uncles, teachers, friends, paraprofessionals are going to be able to actively participate in. Next aspect is we want to design interventions that work effectively within natural routines. The point of PBS is to increase the functioning of our clients, our learners, our students. We need to select interventions that are going to be helpful to have them be successful in the environments that they're naturally in. Something that works in maybe a laboratory or an experimental setting, we cannot assume that it's something that's going to automatically generalize to the natural setting. And we want to always help our clients, our students, our learners be able to contact as much reinforcement in the natural setting as possible. Kind of that good rule of thumb is, if I wasn't here as the technician, as the clinician, and this are the skills that I'm teaching going to be helpful for my student, and I'll just say my client from now on, are they going to be helpful for my client when I'm not here? And then the next thing we need to address is addressing lifestyle changes as a whole, as well as more discrete behavior changes. So sometimes it's a systems change where we can kind of just change a whole way a process works. And sometimes a better intervention is changing just a single piece of something. But we're always looking at the bigger picture. Is this a systems issue? Is this a behavior issue? Is this a skill issue? We're going to look at it comprehensively. Next and last, we're going to create strategies that are durable, reducing dependence on professional. And that goes towards using strategies that are engaging to our caregivers. The inside joke is, as clinicians, we want to work ourselves out of a job. So we want to create strategies that are something that anybody with support and training can implement and they can use regardless of if the clinician is still there. And then that reduces the dependence on professional. So that means that anyone who is caretaking or educating our clients will be able to use these strategies to help increase their levels of functioning. Next, we can talk about how and where we use PBS. So first thing is that how it's always based on measurable changes in behavior. So we definitely need to make sure that we have good operational definitions of what our behavior looks like so that we're able to accurately track it and use that data to tell us, are the interventions that we're implementing working? Is it something we should continue? Do we need to make tweaks? Do we need to alter this? And are there other factors that we can alter that will actually have an effect on behavior? Another major factor is that we are using these natural routines. Again, the goal of using positive behavior supports is to help our clients in the environments that they are in already. We can do that through different ways, by changing some of the systems, changing some of the consequences, changing some of the skills that are in our client's repertoire. And another big thing is that when we use PBS, we're not just using it as ourselves as clinicians. We are making sure that these strategies are something that can be implemented by parents, teachers, direct care staff, anyone who's going to be responsible for the care, the education of our clients. And the major factor, I say that guiding principle is it's based in the function of behavior. So once we can answer the question of why an individual is doing something, then we can go and answer those additional questions too, like what do we do to stop them from doing it? What do we do to increase this behavior? What do we do to decrease this behavior? And we use the functions of behavior. The acronym that is really helpful is SEAT, so SEAT. So looking at S, so the function of behavior could be serving a sensory or automatic function. The function of behavior could be that E, so that escape from a non-preferred task or avoidance from something non-preferred and unpleasant stimuli. It could be A, that attention, and that is a big one. And then it also could be tangible, so things like actual physical items or even access to preferred activities. Generally, the function of behavior, it generally has a primary function, but oftentimes there may be dual functions, or even a behavior may start for a particular function, but then be maintained by different consequences. Once we're able to identify the function of behavior, then we can do different principles or different strategies, and they go in 3 main categories. So these are proactive strategies, our teaching strategies or replacement behaviors, and our reactive strategies or consequences. As we dive deeper into the specific types of strategies and the strategies themselves, one of the things that is wonderful about positive behavior support is that it's a type of support or strategy package that can be implemented across settings. Most commonly, we see implemented in school settings, but it can also be implemented at home, at work. You can use it in different assisted living facilities. The idea is that because it's so much of a systems approach, you can use it in a lot of different settings. Now that we're talking about our strategies, we can talk about our proactive strategies. These are antecedent-based. These are the things that we can do to help decrease the likelihood that challenging behavior occurs before it even gets a chance to occur. Quite often, our proactive strategies are adding a specific cue for our clients to let them know that reinforcement's available, a particular behavior is expected, or what to expect in a particular situation. Often, our proactive strategies are helpful for reducing escape and avoidance-based behavior. And then our goal is to make that problem behavior unnecessary. One of the examples that I tend to use with my families is waiting at the DMV. Nobody likes waiting at the DMV. We all would like to, well, I won't say that. I assume we all like to escape it and avoid it as much as possible. But I know that if I know what's going on at the DMV before I go in, I do a lot better. And so some of these strategies include things like choice making. So simple things like giving our individuals a choice within the activities or the materials or the items that are acceptable to us. So things like if we want to reduce an escape behavior like non-compliance, instead of telling a child sit in a chair, is giving them a choice. Do you want to sit in the blue chair? Do you want to sit in the green chair? We do a lot of things you'll definitely see in schools, things like visual schedules. So oftentimes it's easier for individuals to understand where they are in their day and their schedule. If there's a picture, things are presented visually. And we do a lot of other visuals. So things like visuals of rule reminders, first then charts. And then another main thing is using non-contingent reinforcement. And that's something that we're going to give the individual reinforcement based on the function. And based on that, using that strategy, we can reduce some of those motivational operations that contribute to some of those challenging behaviors. Some other proactive strategies, the big one is priming, not assuming that our clients understand or are aware of what's going on or what's upcoming, and letting them know what's upcoming, about upcoming transitions, potential consequences for behaviors, specifically their expected behavior. We also use strategies like environmental arrangements. So again, changing not necessarily the person or attempting to make changes in the person, but changing the environment around us. We can even do things like demand fading, like reducing the amount of tasks we ask someone to do and gradually increasing as we build momentum. There are several proactive strategies, and again, the purpose of them is to reduce the likelihood that a challenging or problem behavior even gets to occur to get reinforced later down the line. Okay, we've talked about some of the things that we can do before the problem or challenging behavior has a chance to occur. Next, we can talk about teaching strategies and our replacement behaviors. And these are the strategies that we're going to use, or the behaviors we're going to teach in the setting, in the context where the challenging or problem behavior typically occurs. And so replacement behaviors can include skills that offer individuals alternative ways to achieve function of their behavior of concern or respond more effectively to his or her circumstances. And two of the major teaching strategies and things we use to teach replacement behaviors is that functional communication training and our differential reinforcement procedures. So a main goal of PBS is teaching communication. If an individual is engaging in a challenging or problem or dangerous behavior, ideally we want to teach them how to communicate that, or gain access to something, escape from a demand, get sensory input, get attention by using communication instead of engaging in those challenging and sometimes dangerous behaviors. And so a major thing we'll do is using functional communication training. Communication for our individual, for our clients, may take a lot of different forms. It could be, ideally, that verbal communication, but that's not the only way. There are other different ways. We can do things like augmented communication systems, so things like PECS, pictures exchange communication systems. We can use different AAC devices like GoTalks, or programs like Proloquo. And we can also teach things like signs, so things like simple signs like signing that I want to be all done or I want more. Teaching that individual to communicate their needs as opposed to engaging in challenging behaviors to get their needs and wants met. A major way we do that is by using differential reinforcement procedures. There are several. Some common ones include differential reinforcement of alternative behavior. So these are behaviors that are going to serve the exact same function as a challenging behavior. So if a kid's throwing a tantrum because they don't want to keep doing their math homework, we maybe teach them to ask for a break. And that's that functional communication. But maybe we have a learner who's currently nonverbal and they're engaging in challenging behaviors to gain attention. Maybe we'll differentially reinforce and teach picking up a toy and handing it to an adult or peer as a way to get attention, because it's going to serve that same function. Another differential reinforcement procedure is DRO, differential reinforcement of other behavior. And that's things that are when we reinforce literally anything that is not the challenging behavior. This one is widely used because it has so many different practical applications. Another differential reinforcement procedure is DRI, or reinforcement of an incompatible behavior. And these are behaviors that an individual cannot engage in at the same time as a challenging or behavior we're trying to reduce. They're topographically incompatible. So if an individual is engaging in eloping, we can reinforce sitting in their seat, because you can't sit in your seat and elope from an area at the same time. And then there's quite a few more. There's things like where we're differentially reinforcing high levels of behavior versus low levels of the behavior. And we can use and combine these differential reinforcement procedures across settings, across functions. Okay. So now we've used our proactive strategies. We've done as much as we can to try to prevent the behavior from occurring in the first place. We've used our teaching strategies, and we're teaching replacement or alternative behaviors. Now what happens, we've done our best, but a challenging behavior or problem behavior still occurs. That's when we start using our reactive strategies and modifying our consequences. So functional consequences are strategies for responding to behavior or allowing natural consequences to occur, which have previously been associated with problem behavior to reinforce desired behavior. So we know we can look at our antecedents of our behavior, so the things that are happening before, but as we look at our functional relationships, the consequences are the things that tell us what are maintaining the behavior. So when we take that ABC data, antecedent behavior consequence data, we are using that to identify like what's happening after the behavior that's maintaining it. And based on those functions, we can put behaviors on extinction. And so based on the function of behavior, we have specific strategies for placing it on extinction. So if a behavior is maintained by attention, we place it on extinction by using planned ignoring. If a challenge or behavior we're trying to reduce is maintained by escape, we place it on extinction by following through with demands. If it is based or maintained by access, we withhold access, maintain access to whatever that reinforcer is. And if it's something that's more maintained by sensory or automatic reinforcement, then we can do things like response blocking as well. Based on all these strategies, we use a comprehensive plan to try to, again, reduce those challenging behaviors and increase the skills for our client. And so while using our reactive strategies, we will often use redirection as a reactive strategy in lieu of providing any punishment procedures. We can use that redirection as opportunities to support our clients in developing those functionally equivalent replacement behaviors. So in conclusion, positive behavior support is tailored to the individual. It uses a systems approach. It looks at the whole environment affecting the individual's behavior. It follows those principles of ABA, and it has a host of different strategies that we can use at different points in behavioral chain to help reduce the challenging or problem or dangerous behaviors and increase our clients' skills. Thank you.